I asked the question, and I'm not quite sure if I've had the answer yet. I'll come back to you for that answer, and I want you to, for example, maybe just bullet them for me, list them for me, some of the clear strategies that you and the stakeholders are proposing. But we'll do that right after this. Let's listen to the Minister for Health, Kwekwaji Mamenu, who is saying that government will soon come up with a policy to deepen the fight against drug abuse in the country. He was speaking at an international agency consultative forum on strategies for countering counterfeit drugs and substance abuse.
The recent issues on the abuse of drugs, including tramadol and codeine, has become a national threat which requires a concerted effort by all stakeholders to curb it. The effects of drug abuse on the individual, society, and the nation at large includes, but not limited to, the following: loss of revenue. The nation loses money in the form of tax to cater for drug addicts at the psychiatric hospitals, prisons, and rehab centers. Loss of productivity. These victims become inefficient at workplaces. They result in less and less production. Child exploitation. In some neighborhoods, younger children are recruited as lookups and drug peddlers because of the lighter sentences given to juvenile offenders. The current upsurge of kidney problems, their related costs of treatment. Crime rates will definitely increase. Combating counterfeit medicines and drug abuse is everyone's responsibility, from government, industry, policymakers, civil society, the media, and right down to individual consumers. On the part of government, we have quite recently launched the antimicrobial resistance policy, as well as its national action or implementation.
That is the Minister for Health, Kwekwaji Mamenu there. You've heard him talk about the fact that people are using children even because they attract lesser, harsher sentences.
Yeah, so...
And so I want you to, whilst we wrap up this conversation, I want you to list for me some things that we can do beyond, as we wait for Parliament to review the law.
I mean, as we wait for Parliament, what we need to do as a nation is to see addiction as a disease. For every disease that we can have, we have epidemic proportions. We have what we call public health approach. So we start with the prevention, the treatments, and the rehabilitation. So for the prevention, we need to now educate our young people, because addiction is a disease of young people, that these are the dangers of drugs, these are the things that can lead you to, and these are the harmful consequences you use. The treatments, you will not really know who is sick if you don't look for them. So what we are asking now is that as we check everybody's blood pressure for every adult who comes to the hospital, every young person who comes to the hospital, every young person that we come in contact with, we should screen them for drug abuse. So that those who screen positive for drug abuse, they are then taken on for treatment. The treatment of addiction is not a one-off thing, unfortunately. Addiction is a chronic disease. We have what they call remitting and relapsing, meaning that they will stop and go back and use, but that doesn't mean they are not doing well. People with asthma still get asthmatic attacks. That doesn't mean they are not doing well. So we need to treat them. Some people will need to be in a residential rehabilitation. Okay. And then some people, after rehabilitation, would need to be given skills. Then the next thing is, let's differentiate those who use the drug from those who trade, because the traffickers, those who sell, are actually making money for people's illnesses, so that we don't punish somebody for using one roll of marijuana We don't punish people. So that let's have stiffer punishment for those who sell, the drug pushers. Let's have stiffer sentences and make it, I mean, not encouraging for anybody to sell drugs to young people. And as a nation, if we don't tackle this head on, unfortunately, we are doomed for crisis. Well,
hopefully we won't get there. I've been speaking to Dr. Eugene Dodo. He's a psychiatrist and the hospital director with the Anchorford Psychiatric Hospital. Also the focal person for the Ministry of Health on drug abuse. So thank you very much. It's been an insightful discussion. I've learned a lot. So basically what you're doing if you're using tramadol for sexual, related purposes is that it reduces, it delays, he says, it delays the orgasm, but then it wakes you up anyway. But you don't. Am I getting it right? It wakes you up anyway. You're using those who are mixing tramadol and alcohol.
You have other effects. Your heart, your respiratory system. Actually, it can cause death.
It can cause death.
So you can be on it and you are dying, but because you still have energy, you think you're alive.
You're alive, but you're dying.
Sure.
So it kills you without you knowing, basically. And this is something that we need to every now and then push in. So those of you who use it will know what you're subjecting your system to.